You're watching Reality Check. A political cloud has gathered over the rising COVID cases in Kerala, with the centre, the BJP and its proxies criticising the state for fueling a resurgence of the virus in India. The numbers that are being cited to target Kerala are amongst the following. Why Kerala is under COVID fire. 50% of India's new cases are in Kerala. 40% of India's active cases are in Kerala. The average daily cases are up 50% in Kerala, even though it's down by 6% in India. But a deeper dive into the Kerala data suggests a more nuanced picture. One of the reasons driving Kerala's numbers could be that it is amongst the higher testing states. Just look at these numbers of tests per million population. Kerala scores high, amongst the highest in fact, when it comes to testing compared to states like UP, Bihar and so on, which are testing much lower percentages of their population, which may explain also why they have lower COVID numbers. The other reason could be that Kerala has a far lower number of people exposed to the virus. This is again based on data from what are called sero or blood test surveys, which is like a poll of the population to see who's been infected based on the percentage of people found with antibodies for the virus. Kerala has amongst the lowest COVID antibodies. It's just got about 44%, which is the lowest in the country. Madhya Pradesh at almost 80% is the highest. Rajasthan, Bihar, Gujarat, Chhattisgarh, Uttar Pradesh, Uttarakhand all have over 70% antibodies, suggesting almost 70% of the population is infected. The other important test of virus management are reducing deaths. Is Kerala able to contain deaths? Even though cases in Kerala are high, the state's fatality rate is much lower than the national average. So, high cases, low fatality rate. Kerala's fatality rate is 0.5%. India's fatality rate is 1.34%. Also, running counter to the claims of mismanagement, Kerala has one of the highest vaccination coverages in the country. So, it's a paradox. You have high infections, but also high vaccination rates. Percentage of population fully vaccinated, India is 7%, Kerala is 17%. And these are the high states with vaccination coverage. Andaman and Nicobar, of course, small islands, Tripura 18%, Chandigarh 18% and Kerala is at 17%. So, joining us now is Veena George, the Health Minister of Kerala. Thank you, ma'am, so much for joining us.
Thank you.
How would you like to respond to this criticism which is being directed Kerala's way, which has taken on somewhat of a political color, that we are seeing, 50% of India's new cases are in Kerala, 40% of the active cases are in Kerala. So, the suggestion is that somehow you're not able to control the virus.
The case was the same in the first wave too. The second wave in the state started by the middle of April and we had our peak on May 12th. On May 12th, we had the maximum number of cases on a single day. We had then more than 43,500 cases. And then the cases went on decreasing and it reached almost like a plateau. And when you analyze the situation during the second phase, the second wave, the Delta variant is causing the disease in the state and the infectability of the Delta variant is very high. And also, as you know, Kerala, the density of population is very high and it's almost double the national average. And also we have many more challenges like the senior citizen, the percentage of senior citizens in our population is almost 14%. And we have evolved a clear strategy even before the first wave. So our strategy was always to do tests, do the tracing, and we give the treatment. And also we enforce the containment measures, and it's like that. And Kerala is a state where we do maximum number of tests. Yesterday we did more than 1,63,000 tests, and the day before yesterday it was more than 1,93,000. So it's the highest in the state when you consider per million population, test per million population. It's the highest in the state. The ICMR study, the fourth study conducted by the seroprevalence study conducted by the ICMR shows that more than 50% of the total population of the state is unaffected. It shows that 42.7% of the total population has antibodies in their bodies, which shows that it can be either through infection or through vaccination. So anyway, it shows that more than 50% of the total population is still unaffected. It means that our protective measures were very good, that our defensive measures were very good. So the only way before us is to give give more vaccines, or our aim is to vaccinate all the people within a minimum time.
Okay.
So
Okay. So you've said many things. Let's just try to unbundle that for the viewer. So you're saying that there are multiple factors, which is why we're seeing a surge in Kerala compared to other states. Which you're saying is not mismanagement, but because of the nature of Kerala. So one, you're saying it's high density of population. Two, you're saying it's got an older population, percentage is perhaps higher than in other parts of India. But the other point you're making is on testing, that you are in tests per million, you are amongst the higher testing states. So is the argument that you're doing a better job at detecting the virus?
Yeah. We are making sure that every single case is identified and it is reported.
Okay.
Because we have already, our plan was our strategy is to delay the peak. So we have always tried to keep the number of positive cases always below the medical capacity threshold. As you know, there is not a single case in Kerala where the patient died without getting oxygen, without getting medical support, without getting a hospital bed, without getting an ICU support. So we have always, our management was to, or we have always tried to keep the number of cases below the medical capacity threshold. So our plan was always to delay the peak, to drag the wave, and we have proved that it's successful. And the virologists and the experts say that this plateau formation in this phase of the wave is quite expected, because Kerala has the most number of vulnerable and susceptible people when you compare with other parts of the state.
Okay.
The seroprevalence study of the ICMR also shows that shows the same thing, that more than 50% of the total population is unaffected.
Right. So,
Yes.
so essentially you're saying that because the nature of the Delta variant is such that it is spreading everywhere, and so cases are going to go up, but because you have more of a vulnerable population, elderly, but also because a large percentage of the population is still not affected, right? As you just said, seroprevalence you have amongst the lowest, somewhere in the 43% range, compared to states in the north like Madhya Pradesh has almost 75%. I think UP, other states also have over 70%. So a large swath of Kerala's population is still vulnerable, and that's why it's spreading.
Yes, it's one of the reasons, and also there are other aspects to density of population and all. But anyway, when you
But when one looks at, but just one thing though, that is the case then that you're saying that it's not because you've not been able to do a good enough job of crowd control, of being able to control people from going out, because the suggestion is you may have mismanaged that.
No, so when you come to Kerala, when you see the people, they wear masks always, even if they are in their offices or even if they are looking outside and they are in the shops, they wear masks, and they always use sanitizers, and also they also observe the social distancing when they are outside. So in Kerala, the people cooperate very much to all the measures adopted by the government in all the containment measures of the government.
Right.
So, in Kerala,
so people are, you're saying people are being responsible. It's not as it was suggested that people are being reckless and government is not able to control it.
And the situation in Kerala is absolutely under control. How do you analyze it? See, you take the data of hospitals, the occupancy of hospitals, the present occupancy, the occupancy in hospital beds is less, the ICU occupancy is less, and the demand for oxygen support is also less now, which means that the severity of the disease is less in this phase of the wave. And also, when you consider the death rate in Kerala, how do you say that the measures adopted by government is good or bad in this case of a pandemic? It's based on some conditions. One is the death rate. So the death rate in Kerala is one of the lowest in the country. Now the death rate is
the figure we have at the moment is that your fatality rate is around 5%. I beg your pardon, your fatality rate is around 0.5%, and the national average is around 1.3%.
Yes.
So you are considerably lower than the national average. That's the point you're trying to make?
Yes, our fatality rate is around 0.5, and we are doing the excess death analysis. So definitely some deaths may be left out because at the time of reporting, because they don't have the medical bulletin, so they don't have the lab reports of anything. But we are trying to include all those deaths in the list, and even if we add those excess deaths or all those deaths which went underreported, again the fatality rate in the state will be 0.8 or 0.7, or it will be somewhere like that. So the death rate in Kerala is low.
So you're saying the death rate, so the important things that worry people, which is that the hospital occupancy, shouldn't be out of control, the death rate should be under control. You're saying those measures are in place. So even if the overall number of cases may be rising, these critical factors are under control. And also you're saying crowd control is a major problem. But ma'am, there was the allegation though that some of this was because of your relaxations during Eid. And again, this is a kind of BJP right-wing argument that particularly in the Muslim dominated districts of Kerala, especially in the north, they've seen a bigger jump. And that's because you were bringing in these Eid relaxations.
The government of Kerala has already given strict instructions on conducting marriages, on conducting public functions, or on public gatherings. Not more than 20 people is allowed in a marriage. Not more than 20 people is allowed in a funeral. Not more than 20 people is allowed in a meeting. So you are talking about the relaxations the government gave during Bakrid, but it was not for Bakrid. All our traders, our sellers and the shopkeepers were asking for relaxations, and it's one of the seasons when they get more business. So at that time, the test positivity rate of the state was almost 11%.
Okay.
And now it's almost 11, 12, 13%. So the government is closely monitoring the situation. So
you're saying that it's not because of Bakrid that we saw a jump in the infections, because in certain of those districts, the fact that the cases did go up in Malappuram and so on?
No, even before that. So even before Bakrid, even before the government giving relaxations, the CPR of Malappuram, Kozhikode, and also almost in all the districts, the CPR was around 10-11%.
Okay.
So it's quite unfortunate that
the case positivity, CPR is case positivity rate, just for our viewers, yes.
Yeah, it's just positivity rate. So it's quite unfortunate that some people, they say, intentionally, with some political intentions, they say that it's due to Bakrid. It's quite unfortunate.
Okay, but you're saying that actually there's no problem in Kerala, there's nothing to worry about, but the centre doesn't seem to agree. They underline Kerala in all their briefings, and I believe they're even sending down a central team to help you control the virus.
See, when you consider the vaccination, our vaccination, we have a very good system, and the vaccination per million in the state is one of the best in the country. And that is given in the central government of India's COVID portal. They have given all the data. So the real-time entry is being done in the portal, and it's seen. We can read the data from the government of India's portal. So we are doing vaccination at the best possible pace. The second thing is that the death rate in Kerala is one of the lowest in the state. The third thing is that the seroprevalence study conducted by the Indian Council of Medical Research shows that more than 50% of the total population is still
that I agree.
asthmatic.
But what do you make of the fact that why is the center repeatedly pointing out the problem, and also they're sending a team down to
Yeah, we are welcoming the team.
Kerala.
We are welcoming the team, and we are open to their comments. And the team had visited Kerala a couple of weeks ago, and I had an interaction with them. And they told us that they visited many places. They visited our hospitals. They went to many districts, and the thing they communicated with us was that they are quite satisfied with the measures the government is adopting in controlling the disease. And they told us that the TPR, and then the TPR was around 11%. They told us that the plateau formation at that phase or at this phase is quite expected, because when you consider the different factors of Kerala, the plateau formation, as almost all the experts and the virologists say, is that the plateau formation in this phase is quite expected. So the central team which visited Kerala a couple of weeks ago, they also expressed the same satisfaction, and we are welcoming the new team also, and we are open to their comments.
Oh, so the central team that came 2 weeks ago, they were satisfied with how it was being handled?
Yes.
They didn't raise any problem. They didn't say that you're making a hash of it, or it's a bungled response, anything like that.
No. They told us that this is expected. The plateau formation is expected because it's a Delta variant. It's the infectability of the virus is high, and also the susceptibility of the population is high. So when you consider all these factors,
right?
They said that they are satisfied.
So why do you, ma'am? Then why do you think it is? Then why is it that again and again we keep seeing the centre and also the BJP repeatedly bringing up Kerala as a problem?
Maybe, I don't know. That's why I told it's quite unfortunate. But Kerala is open to all these visits, and we are welcoming the visit. And anyone can come to Kerala and they can see what is going on here, how we are controlling the disease, and they can check the data. They can go through the data, and they can analyze the situation. But I think there is a campaign against the state.
Okay,
maybe because
but I want to ask you about vaccination though, because as you mentioned, you have a very high percentage of population fully vaccinated. I believe it's close to 17%, which is amongst the higher states as far as vaccine coverage is concerned. But there is a shortage of vaccines in the country, and that is becoming a problem for us as we fight to hold off against the third wave. How much of that is a problem? How much of a shortage are you facing in terms of being able to get vaccines?
2 days ago, we literally left out of vaccines. Our stock was zero. And we asked for more vaccines. And the central government gave us 9 lakh doses of vaccine day before yesterday. Okay. And we are administering the doses of vaccine. Yesterday, we gave almost, we vaccinated more than 2.5 lakhs of people, and today also we are doing the vaccination, and the stock will be totally, we will be out of stock tomorrow. So again we need vaccine. Yeah.
So 2 days ago you were down to zero, and whatever you got, you are going to run out by tomorrow.
Yeah. There will be no vaccine for the day after tomorrow.
Wow. Give us just an idea of the numbers. What is the capacity? How many lakh doses can you administer in a day versus how much are you actually getting? What's your capacity?
See, we can, the administration of the doses, it actually depends on the doses we get. Yes. So day before, 4 days back, we were able to vaccinate more than 4.9 lakhs of people on a single day. Almost 5 lakh people. But then we got almost 9 lakh doses. So we were able to give 4.9 lakh doses of vaccine to people, or we were able to vaccinate 4.9 lakh people. And day before yesterday, we got 9 lakh doses, and we divided it into like 3 lakh, 3 each day.
Okay, right.
Yesterday we did 2.5 lakh doses. We administered to 2.5 lakh doses, and today we'll be doing more.
But this
And
is, ma'am, a big problem. How do you
Yeah.
think that the center should, because if you look at it overall, we've also been studying this very closely, that vaccine production in this country is not that high. They're only producing about 45 lakh doses a day between the two big manufacturers, and we should be ideally doing close to 1 crore doses a day if we want to, meet our targets that the center has set. So we're just only producing half of what is required, which is why states like yourself, every state is facing a shortage.
Yeah. So far as Kerala is concerned, the only way before us is to vaccinate our people. So we are asking the central government, according to the policy of the central government, we have to depend totally on the central government for getting vaccines. So we are asking central government for more vaccines, and in Kerala, we are planning to do the protection of vaccines, and we have invited the companies to come to Kerala and for the protection, and the initial stage we'll be having fill finish units, and
I see.
we have almost the Honorable Chief Minister of Kerala and ministers, myself and Industrial Minister, we have all had some meetings together with our secretaries and all, and we have drafted a plan, and we are going forward.
Which companies have you invited, if I may ask?
They are floating the tender now. Yeah.
Okay. But these are the international manufacturers or the Indian manufacturers?
The details of the project will be announced soon by the Honorable CM, but we are working on that. Yeah.
So in conclusion, what would you like from the center in terms of, vaccines of course, but otherwise do you need any other intervention, or you're saying that you have it covered, you have it under control?
We need vaccines. We need vaccines from the central government. We need more vaccines. We are requesting for more vaccines because the ICMR study also shows that the state needs. So our request is to give us vaccines as per the percentage of the vulnerable or the susceptible population. So not according to not on the total population, but considering the number of susceptible or vulnerable persons in the state, give us more vaccines. We are requesting the government of India to give us more vaccines. Okay, so vaccines is really what you need, and also you're saying there's almost seems to be some kind of political campaign against the state to make it seem that you are fueling a third wave. But very last question, you say that in every way you've taken all steps to contain it. Is there anything that you feel you can do more to contain the virus? Do you feel you need to strengthen restrictions of movement, perhaps more lockdowns, anything more beyond what you're doing? See, we have a clear system where we are trying to do, as I told you at the beginning, we are testing, we are tracing, we are treating the people, and we are doing the containment measures, and also we are moving on. Right. And we'll be able to decrease the number of cases soon. Okay. Well, we wish you all the very best, ma'am, and thank you so much for taking out time and answering our questions. Veena George, Health Minister of Kerala. Thanks very much indeed.